Can you hear me? Hello? Can you hear me, sir?
Yeah, can hear you, but not loud enough. I don't know what about the rest. Can you hear now, man?
Yeah, we can hear, but not loud.
Okay, sir, can you hear me now?
Yeah.
You can make it more louder.
Can you, sir, see the slide also, sir?
Yeah, you can see the slide.
So you can see the slide also, sir? And you can hear
Yes,
me also.
no problem. You can see the slide.
Oh, that's good. That's excellent.
Okay, that's great. Okay, I think you are ready now to go. So I think we got about 10 minutes. I will play the second video. When we finish the second video, then Dr. Asad Malik will take on the session. Okay?
Thank you.
All right.
Okay, sir.
The International College of Dentists is the oldest and largest international honour society for dentists in the world. Established in 1928, the college has more than 12,000 members in 122 countries who've been awarded the prestigious title of Fellow in the ICD. Our motto is recognising service and the opportunity to serve. ICD aims to achieve 5 goals following the 5 college core values to which they're linked: leadership, recognition, humanitarianism, education, and professional relations. Leadership: to uphold the highest standard of professional competence and personal ethics. Recognition: to recognise distinguished service to the profession and the public worldwide. Humanitarianism: to foster measures for the prevention and treatment of oral disease by encouraging and supporting humanitarian projects. Education: to contribute to the advancement of the profession of dentistry by offering the growth and diffusion of dental knowledge worldwide. Professional relations: provide a universal forum for the cultivation of cordial relations within the profession and to assist in preserving the highest perception of the profession. The Office of the International Council is the world headquarters for the ICD, located in Flint, Michigan, USA. The Council office conducts the daily business and affairs of the college and is representative of the International Council. The International Council is ICD's signature institution and umbrella organization for the worldwide membership and sections. There are 40 members of the Council, including the international officers and councillors who represent ICD's sections and regions in 122 countries around the world. ICD constitutes 15 autonomous sections to facilitate administration at local and regional levels and to promote more effectively the aims and objectives of the college. There are currently 11 regions within Section 20 Asia sector that cover 16 countries. The number of countries under Section 20 Asia sector is expanding, and we've significantly grown in the number of new members over the past year. In Section 20 Asia, there are 7 categories of membership with different requirements for each of the categories. Emeritus Fellow, Master Fellow with Outstanding Contribution, Master Fellow, Honorary Fellow with Outstanding Contribution, Honorary Fellow, Fellow with Outstanding Contribution, Fellow for a member with at least 5 years clinical experience who has delivered significant contribution, Honorary Member, Member or Elite who has served the ICD with distinction, Member or registered dentists, young dentists with less than 5 years clinical experience. Elite, non-dental profession member, student, or undergraduate students. Fellowship in the college is extended by invitation only. A nominated dentist or member of the society must pass a rigorous peer review process, leading to the recognition of the individual's outstanding professional achievement, meritorious service, and dedication to the continued progress of dentistry for the benefit of mankind. We believe a collective effort and ideas from both dentist and non-dentist professions will contribute to a more successful collaboration, making ICD a vibrant, agile, and dynamic organization.
Asia is actually one of the largest continents, and with a very vast diversity in terms of cultural as well as ethnic group, as well as even in the language. So, and there's a huge disparity in terms of income as well as the oral hygiene. What is very important at the center of my heart is that we will need to be able to give to the less developed country for humanitarian projects such as community dental service, eradication of dental caries, control of periodontal disease, which is also known to be closely associated with the heart disease as well as strokes and other systemic disease. So there are a whole range of dental problems that ICD could actually work with. This is something that I'm going to share it with the rest of the dentists in Asia as well as in the world. I'm going to make many young dentists aspire to join ICD and to volunteer their service, which is essentially what ICD motto is, to serve and to recognize the service.
The International College of Dentists is the world's oldest and largest honor society for dentists. We honor dentists who have shown outstanding merit in their contributions to the profession and to the community. We do this by conferring ICD fellowship upon them. Together, ICD fellows around the world give back to their communities by providing humanitarian dental care programs. We give back to the dental profession through dental education initiatives. We support humanitarian dental care projects in over 55 countries. We promote dental education around the world so that the best dental oral health care is available to patients everywhere. We're trying to grow the college and we're looking to honor every deserving fellow worldwide, and thinking the top 2% in the areas of humanitarian service, in education, in leadership, in mentorship. The other thing that the college is doing, and the reason that we would like to have more members and a greater global presence than we even have now, is that we are trying to become known as the worldwide leader in provision of dental humanitarian services. That, I think, is a goal that we have. It's also a mission that we've taken on because we have a great wealth of talent in our manpower, in our fellowship. We have a lot of the dental educators, the providers of humanitarian service, and we do very well in that regard between our fellows. And I think we have not just the opportunity, but the responsibility to provide humanitarian service worldwide.
So come and join the ICD, the International College of Dentists.
Join ICD.
Join ICD.
Join ICD.
Join us at ICD.
Join ICD. Join the ICD. It's a great organization, and we prosper from your fellowship.
Okay, Professor Malik, you can start now.
Ladies and gentlemen, welcome to webinar by International College of Dentists. This is the series of the webinar arranged by the chairman of the educational committee, Professor Ibrahim from Malaysia. And this is our second month going on for the webinars, a continuous webinar. This is a wonderful series that we have started this series by the introduction of the FDA president, and then we have the very famous and educated professor around the world that they are participating in our seminars of International College of Dentists, Section 15. I'm thankful to the president, that is Dr. Hao Kang Chan, that he has taken this initiative to introduce this webinar throughout the world. Today, we are very lucky that we have the very learned personality of Pakistan, and especially in the field of the oral pathology. And he has served many years in education after graduation from the very renowned Dental College of Pakistan, that is Demon University College of Dentistry. After his graduation, he started his post-graduation in oral pathology. And for that, he has done MPhil. And after that, he has done so many courses and degrees with reference to implantology, with reference to medical education, and with reference to so many other fields of dentistry. Now, the professor is the principal of Sharif Medical and Dental College. He is also the head of department. He is the examiner of many universities in Pakistan. He is the convener, and as well as we are lucky enough, he's a very good trainee of the PhD. Ladies and gentlemen, he is not anybody else, but I would like to introduce Professor Nouman Khan. He is a deputy regent of Pakistan International College of Dentists, Region 24, as well as he is the editor of Section 15 International College of Dentists. He has many more credits in his personality, that he is involved in many dental services in Pakistan, especially in many associations, Pakistan Dental Association, and he is the chief executive of the Pakistan Oral and Maxillofacial Pathology All Pakistan. He is the chief executive as well. And I will not take more time, that I am just going to request Professor Nouman Khan to please start the webinar. Professor Nouman Khan.
Good evening, everyone. Thank you so much, sir, for your very kind introduction. Honestly, whatever we are doing today is all due to the, the teaching of our worthy teachers, especially Dr. Ashad Malik. He has been my teacher when I was a graduate. And all credit goes to him for what I am today, and to many of my teachers. So, sir, the credit is all yours.
Dr. Nouman, can you put your mic near to your mouth, that it is
sir.
slightly away? Yes.
Okay, so can you hear me now?
Yes.
Okay. So, first of all, I am very much overwhelmed by the invitation from the ICD for me to speak at this forum. It's a great honor for me. I'm highly thankful and overwhelmed. And I say a big hi to all my ICD friends. And they are a family to us, and they are a family which is distant to us, but at the same time, they are close to our hearts. And I'm very thankful for the invitation. Today, what I am here to share with you is a little bit about the dental practices during the COVID-19 pandemic. And I will be discussing a guideline which is currently being practiced worldwide and is being initiated by the American Dental Association. Okay, so let's go through it. There is a lot to talk on this guideline, but I would like to at least educate some of my, you can say all of my fellows who are online with me, so that they can improve their dental practice, especially during the pandemic time. So what we will be doing right now is that we will be discussing what is coronavirus. You all know about it, so we'll be going through it very quickly. What are its clinical presentation and how the COVID has affected our country, Pakistan. Then the dental health care personnel, how they are going to play their role in the transmission and prevention of COVID-19. And then there is going to be some decisions regarding the emergency treatment and non-emergency dental care treatment. Then we are going to discuss about the CDC guidelines and standard precautions. And then there will be some recommendation by the CDC for delivering the dental care based on the extent of transmission of infection. Then there will be overview of treatment guidelines for the dental emergencies. Okay. Sir, can you hear me, sir? Right, I can hear you. Okay. So we know that the pandemic has hit the world, and it is now known as the coronavirus pandemic. It's an ongoing global pandemic which is caused by a severe acute respiratory syndrome coronavirus, also known as SARS-CoV-2. And we know that it is a virus which is basically affecting our respiratory tract and causing symptoms similar to that of a common flu, like cold, and also symptoms similar to pneumonia. The virus usually resides in the bats and other wild animals and are transmitted to human directly or via other animals, and can be transmitted from human to human through the respiratory droplets. We know about the structure of the virus. It is glycoprotein membrane surrounding the nuclear core, which is RNA genome, and then has a nucleoprotein. Then outside is the membrane protein, and then it has ligands attached to it, and especially which needs to be mentioned is the heme communication space ligand, which is highly rated.
Dr. Numan, please keep your mic near your mouth.
Okay, sir. Is this fine? Is this fine if I keep it like this?
That's fine now.
Okay. So we all know that when it started, it was last year in December, where it was first reported in Wuhan, in China, and China alerts the WHO for the several pneumonia cases, and then we see that on the 7th of January, the France confirms you're the first coronavirus case. Then on the 11th of January, there was the first death due to the coronavirus. On 13th of January, we know that the WHO reported case in Thailand, the first outside China. Then on the 30th of January, China alerts the WHO of the several pneumonia cases in the country. On the 2nd of February, first death outside China was recorded in the Philippines. Then the 7th of February, Chinese doctor and the whistleblower Li Wenliang died due to coronavirus. And on the 11th of February, this virus was named as a COVID-19 virus. And on the 14th of February, it was the first case diagnosed in the Africa. So can you hear me, sir? Is the voice clear?
Absolutely clear. Go ahead, Noma.
Okay, sir. Sir, have you ever faced the problem that the slide gets stuck and is not moving forward?
You can bring back and restart again. No matter.
Okay, sir. Okay. Oh, yes, that's good. That's good. Thank you for the suggestion, sir. Okay, so the virus, the virus has been reported in several animals, and it's mostly been affected in the human through the spillover. And some of the symptoms are mentioned over here. We know that more precisely is the high fever and shortness of breath, coughing, and pneumonia. but in some cases, vomiting and diarrhea is there, and other symptoms associated with the fevers like body aches and where pains, body aches are there. So how we can basically take measures to generally prevent this virus transmission to other individuals? We are mostly like the last 4 months we are hearing this. Just overview: frequent hand washing is there. Avoid contact with the sick people. Do not touch the eyes and nose and mouth with unwashed hands, and should avoid eating raw food. Only thoroughly cooked meat and eggs should be taken. Contacts with the animals and animal products should be avoided. And if you are infected, then it's better to stay at home, avoid contact with others, cover the nose and mouth when sneezing, and should keep the objects and the surface clean, and wear the surgical mask at all the times. Okay. Okay, a bit about the traveling advice, especially during this pandemic, mostly for those who are in love of traveling. Our president, Professor Dr. House, is very fond of traveling, and Dr. Ashar Malik is also very fond of traveling. So, a piece of advice for you guys specifically: avoid traveling to affected areas unless very necessary. Make sure you have all necessary vaccination and travel medication. Seek advice from your healthcare provider. And in case you have any of the symptoms, should avoid the traveling. And if you become sick while traveling, seek medical care immediately. So a bit about the clinical presentation before we move quickly to the guideline. Patient can have the presentation in the form of asymptomatic infection, mild infection, moderate infection. Normally, we see that there will be absence of any clinical signs or symptoms in case of asymptomatic infection. The chest X-ray or the CT scan will be normal, but the SARS-CoV-2 test will be positive. In case of mild infection, there will be some upper airway symptoms like fever, fatigue, myalgia, cough, sore throat, nose, running nose, and sneezing. But there may not be a fever. So patient may come to you with mild infection and the patient doesn't have fever, but they will complain about the gastrointestinal tract symptoms like nausea, vomiting, abdominal pains, and diarrhea. Then the patient can be having a moderate infection like pneumonia, persistent fever, dry cough, which becomes productive later on, wheezing, crackles, or auscultation during the respiratory examination. And the CT scan of the chest will reveal typical pneumonia lesions. In case of severe infection, one of the very striking diagnostic findings will be that there will be blood saturation getting low, lesser than 94%, and then there will be some respiratory symptoms which will be associated with diarrhea and other symptoms like dyspnea and hypoxia will be there. And most importantly are the critical infection findings, and in which we will see there will be acute respiratory distress syndrome or even the respiratory failure. And the patient can enter into shock, encephalopathy, myocardial injury, or heart failure, coagulopathy, acute kidney injury, and multiple organ dysfunction. So this is like the last stage. So a bit about the COVID in Pakistan. COVID has also not spared our country. The first case was diagnosed on the 26th of February. And after that, the cases they started to increase in number, where then the government decided to announce for the lockdown on the 22nd of March, and then the lockdown was kept for about 1 month and 19 days. Till on the 9th of the May, the lockdown was ended. And then it was later on assessed that there was still increase in the number of cases. So by the 15th of June, exactly, if we move back a month back, there were about 150,000 confirmed COVID cases. And after this, on the 17th of the June, the government decided to go for a smart lockdown in some selected areas, and overall 197 such areas were identified where there was a reported increased number of cases of COVID. So those areas were locked down. So a special smart lockdown practice was done in Pakistan. And this is exactly a picture of yesterday. If we look, there were about 253 confirmed cases of corona, and the patients who have recovered till the 14th of July are like 1,70,256. So we have a good number of patients who have recovered from this virus. However, there have been some deaths, 5,320. The total number of deaths are quite less as reported in many other countries. Overall, worldwide, we know that about 250,000 deaths has been taken place by today, like the 15th of July. But in Pakistan, these are a very less number of cases reported. So we, in that context, are we can say a bit happy to report lesser number of deaths. But even then, the pandemic is still hanging on our head. So coming to the main topic, that is the dental health care. And we know that for the dental health care personnel are the most important persons, and these are those which are by any means serving in the dental health care settings, and they have the potential for direct or indirect exposure to patient or infection material, which can be any like body substances or contaminated medical supplies, devices and equipment, contaminated environmental substances. So these dental health care personnel are the ones who are at high risk of getting infected or even transmission of this virus. So if an infected patient comes to our surgery, the number one way of the transmission is through the sneezing and coughing, which will leave active droplets in the air, and then that can cause a contamination of the dental unit and all the objects which are in the close proximity. And when the dentist performs any dental procedures in which there are aerosols being generated or droplets being generated, that can basically affect any of the susceptible individuals in the close vicinity, which can be any other dental health personnel or the assistant or the staff. And the dentists are at high risk through the direct contact with the patient and also through the indirect if the surface gets contaminated and through the contact of such surface. So for the COVID, we are trying to follow the American Dental Association guidelines, and today we are going to discuss these in a bit detail. So they are always stressing upon the emergency dental treatment to be performed or preferred, and to say delay the other dental treatments. So we just want to go through what are exactly dental emergencies. We know that these are the life-threatening emergencies which definitely require an active treatment by the dentist, which includes uncontrolled bleeding and patient having cellulitis or diffuse soft tissue bacterial infection. And it can be intraoral swelling or extraoral swelling, and these can be compromising the airway. So if they are compromising the airway, these are basically severe dental emergency cases. Other than that, there can be traumas also which involve the facial bones, and once again, that fracture or trauma can cause the obstruction of the airway and need an emergency. However, there are also some treatments which are classified as under urgent dental care, and those include severe dental pain from pulpal inflammation and pericoronitis, third molar pain, surgical post-operative osteitis, dry socket dressing, abscess or localized bacterial infection, resulting in localized pain and swelling, tooth fracture, resulting in pain or causing soft tissue trauma, dental trauma with avulsion or luxation, dental treatment required prior to critical medical procedures, final crown-bridge cementation if temporary restoration is lost or broken, or it is causing a trauma to the adjacent soft tissue or gingival irritation, or in case of any pathological tissue and requires a biopsy. These are all urgent dental care and they need to be addressed. Okay, then there are some non-emergency procedures like, you know, that initial or periodic oral examinations and recall visits, including the routine radiographs, routine dental cleaning, and preventive therapies, orthodontic procedures. Other than those, we have already discussed in the dental emergencies. and other issues critical necessary to prevent harm to the patient, extraction of asymptomatic teeth, restorative dentistry, treatment of asymptomatic caries, pains, static dental procedure. All of these are non-emergency procedures. What we have done is we have shortlisted them and highlighted over there. So, what does the guideline says about these treatments and therapies, and what measures should be taken for minimizing the risk of the COVID-19 transmission? So, if care, you can say the guideline initially starts well before the dental procedure is even initiated. So, we can classify is that before dental care starts, there are some preparations which are needed to be done to the dentist and the dental team. First of all is ensuring safety of the staff. This is very, very important because as important is the life of the dentist is equally important life of the staff. So what we need to do is that we should ensure that the dental health care personnel have received their seasonal flu vaccine, and in case they're experiencing any symptoms like influenza-like illness, like fever, cough, or sore throat, muscle aches, should not report to work. And then, if the dental health personnel are older in age, like the cutoff value is different for different countries. Some say they should be 60 above, some say 65 above, but they are having any pre-existing medical compromised condition or pregnancy, etc. They are basically considered as a high-risk individuals for contracting COVID-19 infection. So, if they can avoid doing the practice, they should avoid it. And then at the same time, dental healthcare personnel should self-monitor for their own signs and symptoms for COVID, like cough, shortness of breath, sore throat, and they should try to check their temperature maybe twice to thrice a day. That's very important. Second is the office setup. Office setup, we need to make sure that we have abundant PPEs available and should be prepared in a way that there is a scarcity of PPE in the market. So we should have abundant PPEs at our hands. Then we should also take some preventive measures, like we should try to remove all the magazines or any reading material, toys, and any other objects which cannot be touched, which are being touched by the can say dental care personnel or the patient or the can say any other staff members. So they should be removed because they can't be easily sterilized. So they can't be. So, secondly, we should all try to place some signage in the dental surgeries, in which we can basically like print and place signage in the dental office for instructions of the patient, and on the standard recommendation of the respiratory hygiene, of etiquettes, and social distancing. So these signage should be displayed in our surgeries, in our hospitals, in our clinics. And then last is the appointment schedule. We should try to minimize the patient exposure to the clinic, and for that we should basically try to make them wait less in the waiting area, as much less as possible. And we should instruct our patient that they should avoid bringing any of their, you can say, companies with them. But in cases where there is very much necessary, they should bring. But otherwise, they should try to bring minimum, you can say, companies along with them. That's very important. So, in the before dental care assessment area, we have said that the dentist and dental team preparation is very important. Secondly, the screening of COVID-19 status and priority for dental treatment is very important. For that, we should basically even start the screening through the phone calls, where we should basically see that the patient gives you any history of the recent travel history, or any exposure to the patient who are already COVID positive and they have been visiting them. And then, do they have any signs or symptoms of the COVID-19 infection? So, phone screening is very important, and that should be done through the reception. Now, who can be seen in the dental setting? Okay, if an emergency urgent dental patient does not have a fever and is an otherwise without even mild symptom consistent with COVID-19 infection like fever, sore throat, cough, difficulty breathing, they can be seen in dental settings with appropriate protocols and PPE in place. If an emergency or urgent dental patient has a fever strongly associated with dental diagnosis like pulpal or periapical dental pain, and intraoral swelling is present, but no other sign and symptoms of COVID-19 infection is there, like fever, sore throat, cough, difficulty breathing. They can be seen in the dental settings with appropriate protocols and PP in place. And then, lastly, the referrals. If an emergency or urgent dental patient does not exhibit signs and symptoms of respiratory illness, then the patient should be referred for emergency care with appropriate transmission-based precautions at the dental surgery which are available. And then there are instructions for the patient arrival also, which include the social distancing and about the waiting area, and then there are infection control etiquettes. So they may wait in their personal vehicle in the outside, you can say, vicinity or the facility available to try to minimize their contact in the waiting area if possible. And then there's some infection control etiquettes in which we need to see that. So we are recommending that only asymptomatic patients who have tested negative for COVID-19 infection or recovered patient after 3 days since resolution of signs and symptoms be seen in dental setting. Dental healthcare personnel should ensure that there are supplies for infection control etiquette like alcohol-based hand rubs with 60 to 90% alcohol, tissues and non-touch receptacles for disposal at healthcare facility entrances, waiting rooms, and patient check-in. So all these facilities should be made available by the dentist at their surgeries or their waiting areas. So during the dental care, we need to see a few things, and that is standard and transmission precaution and personal protective equipment. So we need to make sure that there are some standard precautions we need to be followed. And these are like dental healthcare personnel should adhere to standard precaution protocols, like which are minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. And these include standard healthcare precautions or protocols include hand hygiene, use of the PPEs, respiratory hygiene etiquettes, charge safeties, safe injection practices, sterile instruments and devices, clean and disinfected environmental surfaces. And dental healthcare personnel should implement transmission-based precautions. Like necessary transmission-based precautions might include patient placement in isolation, adequate room ventilation, respiratory precautions, example N95 masks for the dental healthcare practitioners or personnel, or postponement of the non-emergency dental procedures if that can be done. Wearing a surgical mask and eye protection with solid side sheet or safe sheet to protect mucous membrane of the eye, nose, mouth during the procedure likely to generate the splashes or the aerosols or splattering is mandatory. Basically the fresh mask and the standard sequences of donning and doping off of the personal.
Dr. Noman, can you hear us? Dr. Noman? Are you there, Dr. Noman? Dr. Noman?
Okay, sir, can you hear me?
Yes, please share your screen.
Okay, sir. Okay.
Yes.
Okay. So we were talking about the clinical techniques. It's very important that there are like mentioning in the literature 1.5% of the hydrogen peroxide usage and 0.2% of the povidone pre-procedural mouth rinses are seen to be very effective in the viral and and then there are no clinical studies basically supporting these, we can say, virucidal effects, but being practiced now after the COVID pandemic. At the same time, there are instructions to avoid intraoral X-rays if possible, because these are the procedures which basically stimulate extra saliva production and even puffing. So if we can use like cone beam CTs or panoramic radiographs, these are going to be.
Professor, can you hold your mic near to your mouth?
Okay, sir. Okay, sir.
Thank you.
Okay, sir. Thank you, sir. And then reduce aerosol production as much as possible. Okay, as the transmission of COVID-19 seems to occur via droplets or aerosols, dental health care personnel should prioritize the use of hand instrumentation. Then there should be usage of the rubber dam for specifically cases in which there is the usage of the handpiece, or where there are procedures like aerosol generating procedures are there, then the rubber dam should be made mandatory. And then then there is another technique known as four-handed techniques for taking care of the patient, in which 4 hands should be used instantly, 2 of the dentist and 2 of the assistant. Then there are anti-retraction function of the hand pieces, may provide additional protection against cross-contamination. Usage of high-volume evacuators, recently it has come into the market, but I will in the end discuss something in addition to this point also. I will take a few minutes extra for discussing that, evacuators also. So dental health care personnel should be aware that in certain situations, backflow could occur when using a saliva ejector, and this backflow can be a potential source of cross-contamination. So at the same time, during the surgeries, when mandatory, use resorbable sutures, and especially the sutures which last for about 5 days intraorally, and should eliminate for any follow-up of such patients possible, and minimize the usage of the triple syringe, as it creates droplets due to forcible ejection of the water and air. Then disinfectants like hypochlorite ethanol, we use it in the handpiece, and triple syringe water supplies have reported to reduce the viral load. So if we can use these disinfectants in the handpiece or in the water supplies of the triple syringes, that can help the viral load reduction and its contamination. Okay, then there are steps after suspected or unintentional exposure. Okay, so for that we need to follow the CDC recommendation, and in the event of suspected unintentional exposure, for example, in case of unprotected direct contact with secretion or excretion from the patient, then we need to follow the CDC recommendation. Aerosol generating procedure should be scheduled as the last appointment of the day. So that is one thing we all need to keep in our mind. For any reason we need to go for aerosol generating procedure, that should be done that should be taken as the last procedure of the day, and should be performed with proper PPE on and N95 mask on. Okay, patient referred for COVID-19 testing should be given detailed instructions on when or where to go for testing, how to justify the need for testing, testing facility listed, and how to contact the dental clinic to report test results. If a test is positive, the clinic needs to report the exposure to all patients treated after the infected patient. Okay, so after dental care is provided, so for that we need to see 3 things. Firstly, the patient in between patients, cleaning and sanitizing the surgical equipment is very important. And then post-operative instruction for the patient, medication as adjuncts to care when going home after a work day, steps to prevent disease transmission before work and home is all very important. So in between patient, we need to clean the PP with soap and water, or if visibly soiled, clean and inspect reusable facial protective equipment. Like the face shield should be replaced if possible between the patient, or they should be properly cleaned with the disinfectant. Non-dedicated and non-disposable equipment like hand pieces, dental X-ray equipment, dental chair and light should be disinfected according to the manufacturer's instructions. Hand pieces should be cleaned to remove debris, followed by sterilization after each patient. Routine cleaning and disinfection procedures like using cleaners and water to pre-clean surfaces prior to applying, and the hospital grade disinfectant to frequently touch surfaces or objects for appropriate contact times as indicated on the product's label are appropriate for the COVID prevention in the healthcare setting, including those patient care areas in which aerosol generating procedures are performed. Surfaces like door handles, chairs, desks, elevators, and bathrooms should be cleaned and disinfected frequently. So these are all very important preventive measures which dental healthcare personnel need to take in between the patient. Then, in the post-operative instructions of the patient, it is recommended to use ibuprofen as normally indicated when managing any type of pain. For example, for management of the pulpal and periapical related dental pain and indole swelling in immunocompromised adults, it is recommended that NSAIDs in combination with acetaminophen, about 400 600 milligrams ibuprofen plus 1000 milligram acetaminophen can still be used. When treating patient with dental pain and indole swelling, dentist should determine whether definite conservative dental treatment, pulpotomy, pulpectomy, non-surgical root canal treatment or incision for drainage or abscess is available. According to the 2019 American Dental Association clinical practice recommendation regarding the use of antibiotics are still applicable for immunocompetent adult patients with symptomatic irreversible pulpitis with or without symptomatic apical periodontitis, pulpal necrosis, and symptomatic apical periodontitis or pulpal necrosis localized acute abscess should be referred to a dental specialist when determining the recommended course of action. And lastly, when going home after a work day, dental healthcare personnel should change from scrubs to personal clothing before returning home. Very important for the safety of the family members. Equally important. Upon arriving home, dental healthcare personnel should take off shoes, remove and wash clothing separately from other household residents, and immediately should take a shower. Okay, so when we talk about like so, what are the decisions for the delivery of non-emergency dental care? As the pandemic continues to evolve and healthcare settings are responding to the unique situation in the community, CDC recognizes that dental setting may also need to deliver non-emergency dental care. And over here, I would like to mention recent research which has been taking place in Germany, and very interesting findings have been reported in Germany, where we see that in Germany they have literally contradicted with the, you can say, stopping over of any dental treatment. Initially, they reported that there was a panic and they did try to avoid doing any dental treatments. Initially, only the emergencies were doing, but later on, they went against this protocol and they started doing all dental treatments, although they were following the PPs. But later on, they transmitted them, their even N95 to normal surgical marks. And there was a study which generated you can say, the aerosols intentionally, in which they basically studied the aerosols which were generated, and they basically saw that the aerosols are being transmitted throughout the room, which is like the normal dental unit with 10 to 10 feet area, in which they reported that the aerosols were seen to go as high as even the ceiling of the room. And then they took 3 separate settings, and for the first setting, they did not use any suction. And for the another unit, they basically used a high volume suction. And for the third setting, they used ultra high volume suction. And then the researchers, they reported that the aerosols which were being generated, they settled after some times onto the ground, and they were seen to like vanishing after about, you can say, 1 hour or maybe in few minutes time. But the interesting finding was that when they were using a high volume suction, they reported that as soon as the suction was started, all the aerosols which were generated in the room, they all were moved into the suction area. So the aerosols in the inventory was all gone. And then they reported that with the usage of ultra high volume suction, even then the aerosols all were being sucked by the suction machine. So they concluded that even if you are using, by the simple usage of the ultra high volume suction is even sufficient enough, and you may not need to go for any additional inventory for reducing the aerosol quantity within the room. They said that the only aerosol that remained after the usage of the ultra high volume was only 5%. And in the 5% of the aerosol which remained in the room, they said that only 2% were having some viral content. The remaining 98% was only having water in it. So they reported that the transmission of virus through the aerosol, they totally contradicted basically what the world is practicing, and that they said that the viral transmission through the droplet or aerosols is very, very insignificant or very minimal. However, if the COVID positive patient comes to your surgery and if there is a direct sneezing or coughing, then and you are not wearing a proper N95 or even they say 3-layer surgical mask, and you are in a close vicinity to the patient, definitely less than 3 feet is the minimum distance, then there are chances that you can get infected, but that is only through direct coughing or sneezing of the COVID positive patient. And in that case, you are not wearing even a normal, simple layered surgical mask. So that's a very interesting research I have gone through recently, and I want to share with all my fellow colleagues over here. So the topic of the research was, should they stop dental practice in the COVID or not? And they totally contradicted this hypothesis, and this is something I am also of, you can say, favor of this hypothesis, that we should not stop all the procedures. We can do all the procedures, but there should be a proper PP and proper N95 mask if possible, but even the surgical masks, the 3-layer surgical masks are proven to be effective. Okay, but prevention is always better than cure. So recommendations by the CDC for delivering the dental care based on the extent of transmission of infection is, this is a decision of giving dental care. For CDC, there is no to minimal community transmission as evidence of isolated cases. Or limited community transmission is there, no evidence of exposure in large community settings. So these are the patients without suspected or COVID, confirmed COVID treated using standard precautions. But for patients which are without suspected or confirmed COVID-19 treated using precaution given ahead, these include minimum to moderate community transmission, which are sustained transmission with high likelihood, confirmed exposure within communal settings, potential for rapid increase in case, and then there is substantial community transmission and large scale community transmission. So this is a patient management overview, which is given. We have basically discussed some of these protocols initially, also in the previous slides. So initial screening, as we have discussed through telephone initial patient evaluation, we have basically gone through it, but let's see if there is a positive COVID patient. We need to follow the standard protocols, and COVID-19 screening, it's just X-ray, and then we need to report to local state healthcare agency if the patient is positive. Elective care is required, or an urgent care is required, or emergency care is required. We need to see that, categorize our patient. In case of elective care, we can defer the treatment for 2 weeks. Close follow-up using telephone or video conferencing can be done. For urgent care, pharmacological management like antibiotic, analgesics, close follow-up using telephone or video conferencing. In case of emergency care, perform dental treatment in active pressure room, airborne infection isolation room. So, before entering a patient room or care area, once again, the same protocol, perform hand hygiene, put a clean gown or protective clothing that covers the personal clothing and skin. Example, forearms likely to be soiled with blood, saliva, or other potentially infection material. Gowns and protective clothing should be changed if they become soiled. And surgical mask or respirator is must. And mask tie should be secured on the crown of the head. Top tie and base on the neck bottom tie. If mask has loops, hook them appropriately around your ears. Respiratory traps should be placed on the crown of the head, top strap, and the base of the neck, bottom strap. Perform a user seal check each time you put on the respirator. And then we need to have eye protections, personal eyeglasses, and contact lenses are not considered adequately eye protection. And then hand hygiene again. Put on a clean, non-sterile gloves. Gloves should be changed if they become torn or contaminated. And then enter the room when we use. Then you have been seeing these donning and doffing protocols. Then preferred PP, use N95 or higher respirator. Face shield or goggles are very important. When respirators are not available, use the best available alternative like face mask. One pair of clean non-sterile gloves, isolation gown, and then acceptable alternative PPs, which includes once again face shields or goggles, N95 or higher respirator or preferred face mask, and one pair of clean sterile gloves, isolation gowns. These are the normal donning and doffing of procedures. We have been seeing them in the last 4 months. I'm sure that most of you will be already aware of it and practicing it. So, like putting on the scrub, on the shoes and the hand wash, putting on the 95, followed by the cap, surgical mask, followed by the goggles and the scrubbing, then on the gown, and put on the surgical gloves, and followed by put on the double surgical. And then doffing off, once again, it's very important because it is the time where there's a high chance that there is a viral load on your gown, then you can on your body surface. So remove the gown and the gloves. Both pair of the gloves should be to come off with gown as they are covering cuffs. Then have gloves removed as one unit with gown. Do not touch outside of the gloves with bare hand. In case of one pair doesn't come off, follow the step 6 and 7. Put on the exam gloves. Remove the shoes and the cover and trauma boots. Keep the rest of the headgear until out of and then remove the gloves, wash the hands, put on the new gloves, remove the goggles and surgical mask and cap, then remove the N95, wash hands and put on the new mask and then take a shower and do a clean scrub. So these are the normal donning and doping of protocols being practiced worldwide. Just a brief overview. Okay, so these are you can say some medicament I have placed over here for those who like to add into the dictionary of the medicines for the relief of the irreversible pulpitis or symptomatic apical perioditis. You can just manage the pain for the first time. Ibuprofen 600 milligram, acetaminophen 325 milligram, and the second line in dexamethasone for 107.5 milligram per kg. And secondary management includes the full phlebotomy. Then, in case of acute apical abscess, in case of this swelling, pain and drainage, if established, augmentin 500 milligram, PD for 5 days, clindamycin 10 milligram, 4 times daily for 5 days, and then ibuprofen 600 milligram, in addition to acetaminophen, up to 500 milligram. And we can also for secondary management call oral surgeon for further assistance for the positive after. So consideration for the supplementation with long-acting local anesthetic like 0.5% UP, which we can pain for immediate pain relief, extra swelling like 25 milligram BD for 5 days for long-term 4 times daily for 5 days, ibuprofen 7 milligram.
Professor, can you hold your mic?
Okay, sir. Thanks.
Thank you.
Okay, sir. In case of avulsion or laxation, for the primary management, if the tooth is replanted, follow pain management protocol, and it's also dependent on the age. In case the first line therapy we are discussing, it's again going to be ibuprofen, 600 milligram, along with acetaminophen up to 500 milligram. If the tooth is not replanted, replant and follow IADT guidelines as best as possible. In case of tooth fracture and resulting in pain, the pain management is done through ibuprofen once again and with acetaminophen. And then vital pulpal therapy is required. Trauma and facial bone. Okay, so for a trauma to the facial bones, and specifically if they're compromising the airway, immediately we should refer it to the oromaxillofacial surgery department. Same goes for the cellulitis and diffuse soft tissue bacterial infection with intraoral external swelling that can potentially compromise the patient airway. We need to refer this patient to the oral and maxillofacial surgery department. And that's all, I think. It was a very detailed guideline, and but believe me, it was still, I guess, so I was just skimming the surface because too much to discuss in this 40 minutes lecture is not actually possible. But I have tried my best to cover all the points, to sum up all the things to my best of my capabilities. But please excuse me for any problems or any point which is not been clarified properly. So over to you, sir. Professor Ashar Malik, sir, it's over to you, sir. Sir, please, sir. So please unmute. We can't hear you, sir. If you can just unmute.
Sorry. It was very excellent presentation. Thank you for giving time to the ICD, and especially I'm thankful to my chairman, educational committee. And it is really promising that all the educational committee of ICD, including Sakhawat Hussain from Bangladesh, as well as Dr. Ibrahim, who is no doubt our chairman of the Education Committee, International College of Dentists. I'm very happy that you have touched the approximately 100 participants, and majority of them, they are from Pakistan. And we have many questions. And before going to start our question, I will love to thank the first question that you have already given the answer, but I will due to my very good colleague, Professor T.C. Poya from Singapore, that he has a question regarding the pressure suction and aerosol generation control. You have very in detail, you have given the answer, but if you will highlight again, that will be more promising. Regarding aerosol control by high pressure suction equipments.
Okay, sir. So the question is over to me, sir? Okay. Okay, sir. Sir, the answer I have already given in the lecture, and that was that the use of high volume suction is good enough for removing about 95% of the aerosols from the dental surgery. Only the 5% of the aerosol which are there, among those 5% of the aerosol, 98% of the aerosol have only water in it. And only 2% can have the viral load. So the transmission through the aerosol is, the recent research is basically contradicting that. So, but definitely the evidence is still less. The research is still underway, but high volume suction is good enough for removing about 95% of the aerosol from the dental cell.
There one question generated to me that some dental surgeons recommend slow speed handpiece. What is your opinion regarding use of slow speed handpiece rather than air turbine system?
Sir, if the procedures can be performed through slow speed handpiece without generating any of the aerosols, it should be done. It should be preferred. Only the high speed handpiece should be used where we see that the treatment is definitely very much important and mandatory. But if the treatment can be done through the slow handpiece without generating any of the aerosols, once again, prevention is always better than cure.
There's one question from Dr. Awais from Pakistan. He is saying that do you think that we return to the dental practice like before, or we adopt these changes permanently?
Sir, I think so. We should adapt these changes permanently, like practicing these protocols and following these guidelines for, we can say, for life is not like, it's not a difficult thing. Like, we're already using the gowns and we are already using the face mask, and 3-layer face mask has proven to be equally effective in blocking any of the aerosols from inhalation. So these precautions, these protocols which we have adapted are, like, we can say, we are mostly practicing it in the past also. But like taking the history and doing some telephonic screening of the patient, these are some of the protocols which we, if we start adapting in our latest practice, would be even more helpful. And I think so we can permanently adapt them for at least, if nothing, for the coming 1 year.
There is one question, Dr. Ali Muhammad Ghauri. He's saying that this is a slightly striking question. He's saying that PPE and all the equipment which are being used are sometimes very expensive. And the practitioners which are doing practice in the periphery and the rural area are sometimes not capable of purchasing all these equipment. And the patient as well cannot bear the expenditure if it is opposed to them. So what to do in these conditions?
Sir, can you repeat the question? I think so. There's some.
He's saying that in periphery there is a few dental surgeons, they cannot afford PPE. So what to do?
Sir, believe me, I have recently bought about so many of these gowns, and believe me, if you try to buy them in bulk, they only charge about 110 or 120 rupees, which is even less than normal, you can say, the cigarette pack they can take for smoking. But I'm just on the light note. But these are very cheap. I can tell you that they are very cheap. These normal gowns, which are sterilizable and even autoclavable, they are very cheap and easily available now in the market. And I have bought myself for about 120 rupees these gowns. So I guess so. Initially, the PPs, Hashmate, I guess they are talking about. Those were expensive, but now the practice has been shifted to the gowns, simple gowns, which are not covering the boots. I think so. These are very cheap and are easily available. They should revisit the market, and now they can find these cheap gowns also. So I think so. No, it is easy for them to practice with these gowns. No problem.
DC Poya from Singapore, he's saying that agri aerosol generation procedure is not significant through use of the high volume suction. The level of the viral load in the oral saliva is not as high even if there is virus in the pharynx. For clarification, if you can add, Dr. Rahman, anything more?
Yes, sir. You're very right, sir. The load of the virus in the saliva is reported to be less, and normally when the procedures specifically, it is said that it is more directly, if the patient is sneezing or coughing, then it is being transmitted to the dental healthcare personnel. To the saliva, it is not being transmitted. Or there are, like, the literature is not reporting any of such cases, or it's very insignificant, which is basically a sign that the viral load in the saliva is very insignificant, and that is why, because it is more in the posterior oropharynx area where there are lymphoid, you can say, tonsillar area, Welda ring, which is basically acquiring these viruses, and overall the virus load in the saliva is less. So it is as mostly in the posterior oropharynx area. That's why overall the saliva, you can say, quantification of virus is less.
That's fine. There's one question that is that you have talked all about the major cities. It is from the same person, and that what do you think about the quacks in Pakistan? There is any way to educate them?
Sir, so you see, like to educate an uneducated person is definitely always difficult. And you see, like if an unqualified person is trying to perform a procedure which is to be done by a qualified person, definitely it is not legally justified and won't be done at the professional level, as you know that. So there is no way that we can educate them, but it's better if we can stop them, either it be through force or through the legislation. But the quackery should not be appreciated or promoted by any means. Uh, they can't be educated. This is what I believe, but they should be stopped forcefully.
There's one question from Fugate. Some dentist has reported being extremely exhausted after a day working using N95. Is this common?
Yes, sir. Sir, during the usage of this N95, it is also said that if you feel a difficulty in breathing through the N95, it means that you are properly using an N95 mask. So, difficulty in breathing is one of the significant feature of N95. It means that the mask is properly placed and it is working properly. So, definitely, sir, with the whole day exertional activity of going through the practice, one will feel highly exhausted uh, through the usage of N95. The way to avoid it is this, that you should try to reduce the number of patients in a day. Rather than doing about 10 patients in a day, if you can avoid and start doing about 4 patients in a day, that can be very helpful. 3 to 4 patients in a day.
Thank you. There's one question from the Faiza Malik. She's saying that is there any method to measure the microbial load of the dental aerosol? I mean, from the research point of view, if anyone want to find it out, can you do it?
Sir, already I have discussed one research in which they have basically quantified the microbial load in the saliva, in the aerosols, and that was the German research I have been talking about. And they have told that the 5% of the aerosols which remained in the air, only among them 2% had the microbial load in it. There was like the 98% in the case there was no microbial load. It was only having the water in it. So there are some way of doing these studies. There is like in which they can use some fluorescent dyes, and then that can be tested through the fluorescent measuring appliances. That's like in our setup we don't have such settings, unfortunately, but in Germany they have managed to do this study.
Dr. Sajair has the question that is the approach for the children dentistry will be the same in the adult dental practice?
So can you repeat the question? I'm very sorry, sir. Please.
That if dentistry in children and dentistry in adults, what will be the difference in approaches?
Okay, so that's a very good question, sir. Actually, the approach should not be different for both. Once you are following all the protocols and guidelines, and you're using the personal protective equipment and N95 mask, should be for the pediatric patient also, and also for the adults. Only thing is that for the children we can do atraumatic restorative treatment, where we can minimize the usage of the high-speed handpiece or aerosol liberating handpiece, and then we can go for an atraumatic restorative technique in which we should go for a conservative treatment more for the children, especially during this pandemic.
There's a question from Amy. We need to use the goggles for eye protection, or we can only use the face shield and that is sufficient?
So basically, the face shield usage is mandatory, should be used during specifically the procedure where aerosol is being generated. It's mandatory, although it is recommended to be used for all the procedures. but this face shield is seen to be sufficient. But if you can wear the goggles underneath it and you can work comfortably, no problem, because many of our dentists or dental professionals, they have like glasses already. And they're using the face shield above the glasses they're already wearing. So if you can wear the goggles, it's good enough, and you feel like your work is not been hampered. You can work comfortably. You should use it. But if you feel uncomfortable, the face shield is also even sufficient.
Dr. Sabha is saying that is it significant to change the speed and design of the handpiece regarding aerosol spread?
So this is a very good question. I guess this is like more towards the manufacturing aspect. If that can be done, although sir, we know that the handpiece speed can be slowed down manually also, and the water supply can be also slowed down manually. That does not require any manufacturing, you can say, modification. If you want to slow down the handpiece speed, you can do it manually, and also the water splashes or splatters can be done manually. I guess there is no need for any manufacturing modification in that.
I think this is a very technical question from Durab Fatma. She's saying that using N95 for a prolonged period of time, will it affect your lungs in any way?
So there has been some studies in which it is reported that if you are using N95 mask and you are going for some exercise, like you can say some cardio exercise, maybe you are going to gym with the N95 mask, or you are on the jogging track with N95 mask, that basically affects your lungs, and that can cause damage to the lung alveoli. So for a prolonged period of time means like if you're wearing it for long hours and even going for some exercise, and so for some, you can say, jogging, something like that, for cardio, you can say, exercises. So it is recommended that the exercises should not be done with N95 on. Rather, if you can use a normal 2-layer surgical mask, that's sufficient. And during the dental practices, this is advisable that if you reduce the number of hours of the practice, number of patients, so that the overall time of the N95 mask should be reduced. And in case of reduced time of the N95 mask, it won't be affected.
I think Dr. Numan, you are lucky enough that we have very good visitor here. The one visitor is Spider-Man. And he is saying that, sir, does the plasma air purifier will help in preventing COVID?
So as I already,
air purifier.
Sir, these are some of the recent, you can say, equipment which has been brought in the market, especially during this COVID season, where they want to reduce the number of, you can say, the aerosol quantification can be reduced at surgery. But as I've already reported that even the high volume suction is adequate in removing 95% of the aerosol vessel. So I don't think so there's any need for the dentist to enter into any of these gimmicks or marketing gimmicks and start going to buy a highly expensive plasma purifiers. If you want to use it, it's your choice, but high volume suction, if you have it at your surgery, is good enough.
There's a very good message from TC Poya to you and to everyone as well. That thank you, Dr. Numan, for good presentation on every private and practice topic. The new normal is indeed different, but the dental practice is always dealt with serious viruses like herpes, hepatitis, tuberculosis, HIV, SARS, COVID-2, and another virus to be managed. Our profession will prevail with best wishes. That is TC Poya from Singapore.
Thank you, sir, TC Poya. Thank you so much for your comment, sir. Thank you so much. So there's a long list of questions.
There are many questions that we are lacking of time. We are just going to take few questions, and then because just a few two more questions I'm going to take, and
Okay, sir.
then we are going to hand over to the president because the time is approximately we have covered all the time, and this. One question is that what the parameter we can use when we return home from the practice to ensure our family practice. What the significant does the oral hygiene has over health of the corona patient?
Sir, once again, we revisit our presentation. I have discussed that that cloning and doffing should be done at the surgery, and if possible, if the shower can be taken at the surgery, but if that's not mostly possible, but then we need to go back into our routine clothes, and then as soon as we visit our home, we should first of all like remove the slippers or the shoes outside the home and go to the washroom where we need to take shower properly and then enter into our fresh slippers and fresh clothes.
Thank you, Professor Noman. This is my last question, which I have taken from this so many questions. That they are saying that will the N95 provide the sufficient seal, or we have to add any surgical mask above it?
Sir, you see, sir, in many cases, a person or dentist feels that the N95 mask is not making a proper seal. And in that case, if they can wear a mask underneath N95, it's good. That gives additional protection. But a single surgical mask and followed by N95 over it is good enough. That's all. If only if you feel like the proper seal is not being made, then you should use one simple 3-layer surgical mask followed by an N95 mask. That's it. Otherwise, a simple N95 mask is good enough.
I think that is there are so many hand raised as well, but I can only choose one. Dr. Aksa, just Aksa, you have 2 minutes. You can ask your question. Dr. Aksa. Can Professor Ibrahim, can you make Aksa available here? So I think that so I think that that's all from the question and answer room, and it is over to Professor Ibrahim for the closing words. Professor Ibrahim.
All right. Thank you very much, Professor Arshad, for moderating this session. And also thank you very much, Professor Nauman, for sharing your experience with our audience tonight. And we hope that our audience will be will benefit from your presentation today, as COVID-19 is the hot issue now, and whether we need to use masks and how many layers of masks. And also the other thing that you have touched about is about the high volume suction. So these are very pertinent issues that you have touched, and we hope that our members who join us tonight will have a good information and how else they can carry out with their treatment in the future. Okay, thank you again, and we hope that this session has been highlighted. And just that before we close, I just want to announce for next week, we will have a speaker from Hong Kong, and this time around we're going to move away from COVID-19, because all the while in the last 5 or 6 sessions, we'll be talking about COVID-19.
Yeah.
Next week, our speaker is going to talk about third molar surgery and prevention of nerve injury. So this is something different from what we have been having for the last 5 or 6 sessions this month and last month. So our speaker is Dr. Mike Yung from Hong Kong. We're talking about third molar surgery, prevention of nerve injury. So I hope you all might free your time to join us same time next week, and we have that lecture by presentation by Dr. Mike Yung. Thank you again, and have a good evening wherever we are. Whether in Pakistan, Bangladesh, Indonesia, Malaysia, or wherever you come from. So hopefully that we meet again next week, inshallah. Okay, thank you very much, and have a good day.
Thank you, Dr. Ibrahim, for hosting all these things, and it is credit goes to the educational committee. And while I will especially mention all the members and especially president of ICD section 15, Datu Haukam Chand, and Datu Ibrahim, the chairman education committee and co-chairman, as well as to the member like Dr. Sakhawat from Bangladesh. Thank you very much, all the participants. Thank you very much.
Okay, thank you. Bye. And see you next week. Bye.
Good night.
Good night.